Hi friends, this is Dr. TVRK Murthy. I am the Clinical Director and Head of Neurosurgery at Care Hospitals, High Tech City. There are mainly two types of tumors. One are the good tumors, which are also called as benign tumors, and the second is the cancerous growths. These cancerous growths can again be divided into cancer which is starting primarily in the brain, glioma or glioblastoma, which is the most commonest tumor in the brain, and cancer which has spread from elsewhere in the body. Usually the presentation is with headache, which is more in the frontal region, on the front of in the forehead region, and headache which is more in the early mornings. I mean, the patient gets up in the morning with headache associated with nausea, sometimes vomitings, and vomitings usually relieve the headache. Sometimes some patients can also present with blurring of vision or seizures or progressive weakness of one hand or one leg or one side of the body. The diagnosis of brain tumors is mainly done by mainly two investigations. One is the CT scan, which gives us a lot of information regarding the location of the brain tumor and the possibility of the type of the tumor which we are dealing with. And to get a better clarity, most of the times we do MRI, and MRI of the brain is also done with contrast, which gives us a good amount of clarity regarding how the brain tumor has to be approached. The management of brain tumors is primarily surgery, and surgery there are different options. There are open surgeries, endoscopic surgeries, stereotactic surgeries. Surgery for the brain tumor these days has become relatively very safe with the availability of modern equipment like the operating microscope, the QSA, and the fluorescence, which is an inbuilt part of the operating microscope, the QSA, the stereotactic frame, and all these equipment really help us, and also the neuronavigation. They help us in locating the brain tumor and trying to save the normal brain and remove only the tumorous part. Usually the outcome in benign tumors, if we do a total excision of the tumor, is very good. Usually most of the patients are cured of the brain tumor, and in case the tumor turns out to be a cancerous growth, these patients have to be followed with radiotherapy and chemotherapy. I want to clarify that with the availability of the modern equipment, brain tumor surgery has almost become like any other surgery elsewhere in the body.